Hello, and welcome to this mindfulness introduction video. My name is Chris Good. I'm a doctoral student here at IUP in the clinical psychology program. I work as a therapist at the counseling center on campus, and I also work for the Office of Alcohol, Tobacco, and Other Drugs, where I do alcohol counseling and substance use outreach. So this video is intended to be a brief introduction to the concept of mindfulness and how it could be helpful to you. We're not going to get super deep into the research or practice, but this is intended for you if you're unfamiliar with the concept of mindfulness, or if you just kind of want to hear it reframed in a different way. I think this is especially appropriate right now. Mindfulness can always be helpful to you, but this is being filmed in the middle of the coronavirus pandemic, and I'd be lying if I said that I didn't often feel like I was elsewhere. If you've ever felt like you're here in the present, but your mind is somewhere else, that is kind of what we're trying to change and work against. Right now, you might be thinking about your family if you're not with them, about the friends that you miss spending time with. You may be having trouble keeping up with school and your academics, remotely, or you could just be thinking about the world at large and everything that's going on. And I want you to know that this is completely natural. Our minds are programmed to be this way. But it isn't the only way of being. This way of being, of feeling like you're here in the present but your mind is elsewhere, that is what we would refer to as the default mode network. This is a neurological term based on years of research and brain scan technology. Basically, the default mode network is a neurological system that engages whenever we are not actively involved in a task. So, if you're focused on getting an assignment done and you're really in the zone, you're not going to be experiencing that. But if anyone has ever looked at you and asked, "What are you thinking about?" that was likely the default mode network in action. It involves thinking about memories from the past, planning for the future, thinking about people, places, things that aren't directly in front of you. And it's important to note that this is adaptive. We want to be able to scan our internal environment and kind of put things together while we're not actively engaged in something. Imagine if you've ever had an experience where you're trying to think of a word or a fact and it's just not coming to you, but maybe hours or even days later, you have the thought like, that's the word I was looking for. That is likely that information coming together because of the default mode network. You can kind of think of it as your brain's power save mode. It's important to note that during this period, we don't have control over what pops into our mind. You may sometimes be surprised by a thought or feeling that you experience, but just know that that's okay, and we never will fully have control over that. Now, it is important and adaptive for our brains to be able to function this way, but that doesn't mean that it's always the most helpful way of being. As the novelist Anne Lamott said, "My mind is a bad neighborhood that I try not to go into alone." Sometimes these thoughts and feelings can bring distress with them. With everything going on right now, you might sometimes be pulled away from the present thinking about all these worrying things and find that your brain is kind of going into a spiral. We have a term for that called catastrophizing. When your mind kind of jumps from one thing to the next, imagining the worst case scenario. That's not adaptive for us to experience all the time and not the most helpful. To kind of talk about this, I'll use one of my favorite quotes. It is from psychiatrist and Holocaust survivor Viktor Frankl. And what he said was, "Between stimulus and response, there is a space. In that space is our power to choose our response, and in our response lies our growth and our freedom." Basically, mindfulness is a tool that gives us that space, that instead of having a thought pop into our mind and feeling like we're controlled by that thought, that we're impulsively acting on that or getting carried away by our thoughts, this allows us to kind of push pause and decide, is this what I want to be doing right now? Is this what's best for me in this present moment? So at this point, you still may be wondering, what exactly is mindfulness? So to explain that more, I want to use another quote, this time by researcher John Kabat-Zinn. He says that mindfulness is the awareness that arises from paying attention on purpose in the present moment and non-judgmentally. So this is a bit of a longer definition, and it has 3 components that I want to break down. The first component is attention. You have to be actively engaged in paying attention to your present moment experience, and not just once, but bringing yourself back to the present over and over as much as it takes for you to give yourself that choice and that freedom. In doing this, we can actually learn to rewire our brains in some way to reduce the time that that default mode network is engaged. The second component is intention. We have to have a reason for why we're trying to be mindful. This could be for mental health reasons. The mindfulness-based practice has been associated with overall psychological well-being, decreased rumination and worrying, and decreased emotional exhaustion. Those are pretty good reasons in themselves. It may also be for general health reasons. Mindfulness has been associated with increased overall health, improved quality of sleep, and with chronic pain management. It may even be of interest to you based on kind of self-exploration or spiritual reasons. Mindfulness, as we conceptualize it now, is in large part inspired and influenced by the concepts of Zen Buddhism, in which practitioners would use mindfulness and meditation as a way to seek enlightenment. The third component of the definition I want to cover is attitude. Now, he says in there, you need to do this non-judgmentally. And there are 3 attitudes that I think of when I think about mindfulness, and that's curiosity, non-judgment, and self-compassion. You really want to approach this in an objective, scientific frame of mind. You don't want to increase your present moment awareness and then label things as bad or good, or be afraid of sitting with uncomfortable emotions if that's what's coming up. It's not about avoidance, but acceptance and giving yourself the choice to decide whether you want to hold on to those or let them go. And also, when you're doing this, you really want to be compassionate towards yourself. I know that we can all be our own worst critic, but really you should be treating yourself as your best friend. If you're feeling these distressing feelings or thoughts come up, if you're having trouble keeping yourself in the present, it's not helpful to criticize yourself, but to treat yourself gently and acknowledge that it's okay. This is difficult. When you're thinking about bringing yourself into the present moment, it's not a matter of if your mind wanders, but when, because this will happen. So acknowledging that, accepting it, and letting those feelings pass. Now, one of the great things about mindfulness is that it's not limited to some guided meditation work or setting some time aside at the end of your day to meditate and reflect, but really this is something that can be applied throughout your daily life. Some people choose to engage in mindful eating, where they focus on the sight, the smell of the food, of the taste and texture as they're eating it, the way that they feel when they've eaten and they're full. Some people may choose to improve their environmental awareness as they're walking between classes, looking up at the sky, noticing, is it blue? Is it cloudy? What do the clouds look like? Is there a smell in the air? Can you feel the breeze against your skin? Really, this is more holistic and about improving the quality of your life by living mindfully. To be clear, while mindfulness can be really helpful for most people, it's not a cure-all. It won't solve all of your problems or get you where you want to be, but as Viktor Frankl said, in that brief moment of pause, in that space between stimulus and response, you're able to give yourself a choice of how you want to react. That you won't be immediately pulled to do one thing or another. And in doing so, you're going to have a lot better chance of getting to where you want to be through your own means. Now, this video was only meant to be a brief introduction into mindfulness. Hopefully you got something out of it, but if you feel like you still have questions or there's some things that still aren't quite clicking, one video that I always recommend and can never get bored of watching is a video by Dan Harris on mindfulness as a superpower. There will be a link for it in the description, but he can describe mindfulness in a way that's much more entertaining and informative than I can. Also, if you would like some more resources or links to articles that kind of founded some of the research that I talked about in this, there will be links for those as well. And if you have interest in some guided meditations, some extra resources for continuing your mindfulness journey, or if you would just like to watch more helpful videos from the Center for Health and Wellbeing, you can check out our channel where we have more to watch. Thank you for watching this video, and take care of yourself.